2020 was a year like no other.
It tested us to our very limits, and we were forced to make choices that felt wholly unnatural to all of us.
We were asked to stay in our homes and to work in the solitary settings of our homes rather than in the humdrum buzz of an office.
Football stadiums were silent. Henman Hill was empty.
Theatres and cinemas no longer full of their captivated audiences.
Without warning, we were thrown into a new way of living.
Suddenly, the realization and impact of isolation, loneliness, and empty routines was a very real experience for all of us.
But before this pandemic, that isolation, loneliness, and emptiness is something occupational therapists have witnessed for decades.
People with physical or mental illness, injury or disease, individuals in forensic settings, people in poverty, those who are homeless can all experience this level of isolation, loneliness and emptiness every day of their lives.
But occupational therapy has the power to change that.
It is the role of an occupational therapist to support people through the difficulties like those mentioned and empower them to live richer and more meaningful lives.
Occupational therapists are problem solvers, finding the best possible outcomes in challenging situations and new, innovative ways of doing, being, and belonging.
Occupational therapists are advocates for people who need help to speak or who cannot speak for themselves.
Occupational therapists are educators, teaching and guiding their clients through therapy.
Occupational therapists are passionate about social justice, ensuring fair and equal access to health and social care for all.
Occupational therapists work in hospitals, schools, communities and people's homes. They work in the NHS, in social care, for charities and the education system.
But most importantly, they work for you, to help you through a challenging and difficult time in your life.
Despite all of the challenges this past year has given us, people all around the world have shown great resourcefulness, finding new ways to keep in touch and fill their days with meaningful and enjoyable activities.
This positivity in the face of adversity is something that OTs see in their clients every day. And it is this which inspires us to do more.
Medicine may add days to life, but occupational therapy adds life to days.